Sharon, and I did my project on the integumentary system. The integumentary system consists of skin, hair, nails, and the subconscious tissue below the skin and the assorted glands. The most obvious function of the integumentary system is the protection that the skin gives to underlying tissues. The skin not only keeps most harmful substances out, but also prevents the loss of fluid, and hair on the scalp provides insulation from cold for the head. The hair on the eyelashes and eyebrows keeps dust and perspiration out of the eyes, and the hair in our nostrils helps keep dust out of the nasal cavities, and nails protect the tips of the fingers and toes from mechanical injury. Fingernails give the fingers greater ability to pick up small objects. The skin and its accessory structure make up the integumentary system, which provides the body with overall protection. The skin is made up of multiple layers of cells and tissues, which are held to underlying structures by connective tissue. The skin is composed of two main layers: the epidermis, made of closely packed epithelial cells, and the dermis, made of dense, irregular connective tissue that houses blood vessels, hair follicles, sweat glands, and other structures. Beneath the dermis lies the hypodermis, which is composed mainly of lost connective and fatty tissues. The disease I picked on my project is the skin cancer. Skin cancer is the uncontrolled growth of abnormal skin cells. It occurs when repaired DNA damages to skin, most often caused by ultraviolet radiation in sunshine or tanning beds. Triggers mutation and genetic defects that lead the skin cells to multiply rapidly and form malignant tumors. The type of skin cancer I picked is atypical moles. Atypical moles are unusual looking benign moles, also known as dysplastic nevi, the plural of nevus and mole. Atypical moles may resemble melanoma, and people who have them are at risk of developing melanoma in a mole or somewhere else in the body. The higher the number of these moles someone has, the higher the risk. Those who have 10 or more have 12 times the risk of developing melanoma compared with the general population. Causes of the atypical moles. Their heredity appears to play a part in the formation of atypical moles. They tend to run in families, especially in Caucasians. About 2 to 8% of Caucasians have these moles. Those who have atypical moles plus a family history of melanoma, 2 or more close blood relatives with the disease, have a very high risk of developing melanoma. People who have atypical moles have no family history or melanoma are also at higher risk of developing melanoma compared with the general population. So are those with 50 or more normal moles. All these high-risk individuals should practice rigorous daily sun protection, perform a monthly skin self-examination head to toe, and seek regular professional skin exams. Treatment. There isn't many treatments for atypical moles, but a dermatologist may sometimes take a sample of a skin mole for a biopsy because of its unusual features, a patient's symptoms, or health history. Fortunately, most moles are not melanoma, a type of skin cancer. However, patients are commonly told they have an atypical mole or atypical nevus after a biopsy. And these are some pictures showing the moles, and then this is a picture of people who have like 10 or like more moles on their bodies, and that's how they look or appear on the patient. And this is my works cited page.